in the graphic here, we have 18% of patients with idiopathic dystonia, 32 of them with inherited isolated dystonia, 18 of them with inherited heredodegenerative dystonia, and 32 of them with acquired dystonia. And in the table on your right, you can see the variants that we have found in our patients. We have 6 patients with variant in the KMT2B gene, one in, for example, in TAP1 gene, one with TOR1A, one with GNA1, and others. And in the heredodegenerative group, we have 5 patients with PANC2, one with Lesch-Nyhan syndrome. And in the group of acquired dystonia, we have 14 patients. 12 of them have cerebral palsy, and 2 of them are tardive dystonia. And in the map on your right, you can see the regions where are our patients from. So they have to travel long distances to get to the initial and, of course, the following sessions. Now, I'm going to show you our group of patients with cerebral palsy and DBS. We follow 12 patients, and the median age at the DBS it is 15 years old. Almost all of our patients, 11 of 12, the DBS, the electrodes are placed in the GPI, but we have one case that I'm going to show you later in this presentation in which we have to use an alternative target. And all of our patients had abnormal MRI. Among the etiologies of the cerebral palsy in our patients, 67 of them have dystonia secondary to neonatal hypoxic asphyxia. 17 of them has dystonia secondary to hyperbilirubinemia, and 8% have dystonia due to premature birth, and 8% secondary to other hypoxic asphyxia. The level of the severity of the cerebral palsy we were measured through the JMFCS scale, and we have 4 patients in level 1 and 8 patients in level 5. And I like to show you some clinical characteristics of our series. 5 of our patients shown dyskinesias, and 4 of our 12 patients presented as status dystonicus at the moment of the intervention. The severity of the dystonia was measured through the BFM-DRS scale, the Fark-Van Marsen dystonia rating scale, which have 2 subscales, the motor subscale and the disability scale. And 50% of our in our whole series, we could see an improvement of 15%, which was statistically significant in the motor subscale, and a median of 0 improvement percent in the disability subscale, which was, of course, non-statistically significant. And this is what you can see in the graphs here. We also measured quality of life in our patients after 12 months of follow-up with the CP-Child scale, and we can see a 24% of improvement in the CP-Child scale, which was statistically significant. And this is one example, one of our patients. This is a 10-year-old boy with generalized dystonia secondary to a neonatal hypoxic asphyxia. In the first video, you can see that he's on a status dystonicus with a severe and disabling dystonia. And in the second video, after the GPI-DBS, dystonia has improved in a very significant manner. And we also could decrease some medication, we could stop some risky medication. And as you can see, the kid has not pain now, and there are also uh, um, findings in his quality of life that has also improved. 5 of our patients showed dyskinesia. We followed it at pre and post DBS with the abnormal involuntary movement scale, the AIMS, and we can see that 4 of the 5 patients showed improvement in this scale with a median change of 36%, and this change was statistically significant. And this is one example of the improvement on the dyskinesia. This is a 12-year-old boy with generalized dystonia and dyskinesia secondary to neonatal hypoxic asphyxia. And as you can see here in the second video, post-DBS, dyskinesia improved a lot, and also dystonia improved. In our series, 4 of our patients presented as status dystonicus at the moment of the DBS, following the recommendation of this very interesting article from the teams of Boston Children's Hospital and 6 kids from Canada. And DBS is suggested when the medical treatment has failed. So in our patient, DBS was underwent for the management of the status dystonicus. And this is one of our patients, another patient with status dystonicus. This is a 13-year-old boy from the north of Chile with a kernicterus with secondary to hyperbilirubinemia. He also presented deafness, and he was very stable until he presented a lung infection, a severe lung infection last year. And in the meantime, he also developed this very severe dystonia with refractory to medical treatment. So he was referred to our center for DBS evaluation. And after the DBS, you can see that dystonia almost disappeared. He is having a better quality of life, and now he is continuing his rehabilitation at his hometown. And this is the last patient that I'm going to present you. This is our more challenging case that we have evaluated in our center. This is a 8-year-old boy who at the age of 5 suffered a severe hypoxic ischemia encephalopathy. He was during a dental procedure. He presented 2 cardiorespiratory arrests. We still don't know the cause of the hypoxic ischemic encephalopathy, but he developed with this severe dystonia, which is very disabling. We have used a lot of medications, and he is still presenting this very severe phenotype. And the last picture is a picture of her post-drink because of the dystonia. This is his MRI. Here you can see the severe damage of the GPI, but also a severe damage of the STN. So the 2 main targets that we use for DBS are damaged. So we had to look for alternative targets. And based on some reports in the literature, we in a multidisciplinary meeting, we decided to place the electrodes in the ventral thalamus, and we aquí me falta. Unfortunately, dystonia is still very severe. We're still having a lot of medications. We could see a very slight improvement, so we are looking for another therapeutic option for this kid for the future. So Based in our series, our conclusions are that motor improvement was significant on the VFM DRS, but not on the disabilities of scale, that we saw a significant quality of life improvement across our patients with CP and DBS, that 80% or 4 in 5 of our patients with dyskinesias improved in the AIMS scaled, and all our patients with status dystonicus were successfully rescued with DBS. We also could see another observations that were not formally measured. Some of them are that in all our series, our patients have fewer dystonic crises after the DBS. We, in a lot of patients, uh, could reduce need for rest medications, and a lot of patients also presented fewer nighttime awakenings due to the dystonia. So maybe these could be very important findings to be considered in the future for indicating DBS in these patients. Finally, our future challenges for DBS in all our patients with dystonia in Latin America uh, are the following. We need to build better clinical registry and long-term follow-up data. We also should promote collaborative work with centers in Latin America and internationally. We should improve access to genetic testing, explore ways to reduce treatment costs and improve access for our patients, train more DBS specialists in our region, and strengthen rehabilitation programs after DBS. And uh, finally, I'd like to show you this landscape from Latin America. I hope that you will be inspired to visit us, to collaborate with our teams, and to discover what our regions has to offer. And I like to thank the movement disorder team of the San Borja Ariaran Hospital and the neuromodulation team from our centers, a group of multidisciplinary professionals who work for the development of this program. And of course, I'd like to thank our patients and their families for allowing me to share their videos, data, and histories. And of course, the work that we have been developing is for getting better access and care for the patient in Latin America. Thank you very much.
Okay, good. Te pasaste como 3 minutos, pero it's okay. I mean, 3 minutos. Tú me
Yeah.
dijiste la vez pasada que era entre 30 y 45 minutos, así que estás más o menos dentro del
Sí,
tiempo, si ese es el rango.
sí,
Así que bien.
sí.
Some corrections here.
Ujú.
Vamos,
Las voy
vamos.
a anotar.
Sí, sí, sí. Ya. Patience, de nuevo, ¿cierto? Patience,
Ya,
cuidado con la S.
sí,
Te pillé una, ¿ya? Pero sí,
ya.
todavía tiendes a omitirme la S, es un caso puntual,
Sí,
¿ya? Cuidado,
ya,
esto ya lo habíamos visto la vez pasada. Inherited. Me dices inherited.
ah, ya,
Es
ya,
inherited. Mira,
inherited.
mira,
Sí,
te lo voy a poner acá en la pronunciation. Inherit.
ya.
Ah, voy
Ahí lo
lento.
había anotado. Inherited, ¿cierto?
Inherited,
Lo había
sí.
anotado.
Ya voy a volver a la. Tengo súper lento el navegador, no sé qué pasa. Inherited, ¿ya? Pequeño, esto es sutil, no es grave. Ya me dices
Inherited.
variants, pero debería ser variants. Variants.
Ya,
¿Ya?
ya,
Pero es una cosa
ya,
sutil, no es grave, o sea, hay otras cosas más importantes que mejorar, ¿ya? Me dices variants, debería ser
ya,
variants,
pero igual.
D, ¿ya? Lo otro, cuando me
Ujú.
hablas
Ya.
de ciertas conditions, por ejemplo, they have CP, they have no sé qué cosa, ¿cierto? Trata de ocupar de nuevo, trata de ocupar sinónimos, por
Ujú.
ejemplo, they present certain conditions, they are
Sí,
afflicted by,
sí,
trata de ocupar palabras que muestren
ya.
bagaje de vocabulario, ¿ya? Yo me haría
Sí,
una lista de palabras, de no sé, unas 5 o 6 palabras que se pudieran utilizar en
sí.
conjunto con conditions, ¿ya? They present conditions, they are afflicted by
Y ahí,
conditions. Dime,
ya.
mira, a ver,
Es que ahí, ¿qué otras podrían ser? Como, porque,
déjame preguntarle a ChatGPT, give me options for
ya.
um, have.
Voy a dejar de compartir.
Conditions. Have conditions. Mira, podría ser. Give me a second. Doesn't have conditions. They are afflicted by conditions. They suffer from certain conditions. They are diagnosed with
Ujú,
certain conditions. They have developed
ujú,
certain conditions. They experience certain conditions. They show signs of certain
ya,
conditions. They live with
ya.
certain conditions. ¿Ya?
Ujú,
Mira, suffer
ya.
from me gusta. They are diagnosed with.
Sí. Ujú,
They have developed,
ya.
dependiendo del contexto. They experience.
Ujú, ujú,
They struggle with, mira, esa también está buena si quieres sonar un poquito más cercano. They struggle with,
ya,
they deal with,
ujú.
they are affected by, they present. Todo eso lo puedes ocupar con conditions y lo que sea
Es
que
affected by,
they have,
¿cierto?
sí. They are affected
Y
by,
they are,
or he is affected by,
y
or
present es present,
they
they
present,
present
they
some
present
conditions. They
conditions. Sí.
present,
Le
ya.
cambias conditions por lo que sea, ¿ya? They suffer from
Sí.
conditions. They are diagnosed
Ujú,
with conditions. They have
ujú,
developed conditions. They
ya.
experience conditions.
Ujú. They suffer from.
They suffer from conditions.
Ujú,
They go through conditions. They deal with
ya.
conditions. ¿Ya? Hay algunas que son más médicas que otras, ¿cierto?
Ujú,
Entonces, be careful with that. ¿Estás bien con eso?
sí.
Ya. Otro, 11 of 12, no, 11 out of 12,
Mm.
o 11 in
Ah,
12,
eso, ya.
11 in
Ya.
12. Por abajo
Out
me,
of.
claro, por abajo me pones 4 in 12, esa está bien dicho. Puede ser 4 out of 12 o 4 in 12, pero no 4 of 12 ni 11 of 12.
In,
¿Ya?
ya. O sea, in 11
11 out
out
of
of 12.
out of 12 o 11 in 12.
Ya.
11
In
out of
11
12
in 12.
patients me suena más accurate. ¿Ya?
Ya.
11 out of 12.
Ya.
Neonatal. A ver, déjame buscarlo bien
Neonatal.
neo,
Ya.
déjame ver si es natal o natal. Pero es neo, definitivamente neo.
Ujú,
Natal.
ya.
Neonatal.
Neonatal.
Neonatal. O natal, si quieres ser.
Neonatal. Ya.
Neonatal. ¿Ya? The level we were measured. The level of severity was measured.
Ya.
Me dice algo así como the level of severity of CP, si no me equivoco, pero
Sí.
the level of
Sí, sí.
severity of
Y si yo digo,
severity was measured.
y si yo
Dime.
digo the severity was
También,
measured
the
también, ¿cierto?
severity, sí, sí, sí.
Ya.
The
Ya.
severity was measured, the level of severity.
Ujú,
Y fíjate que es, ya no, sí, puede ser severity o severity, depende si es British o American. Severity, severity,
ya.
whatever. Después, ya,
Ujú.
cuidado acá, me dices statically, es statistically,
Ya.
statistically significant. ¿Ya? Y eso lo repetiste varias
Está,
veces.
sí.
Statistically,
¿Cómo es entonces?
statistically.
Statics. La vez pasada igual lo dijimos.
Sí, mira, escúchame acá.
Statics.
Mira.
Ya.
Statistically. Te voy a mostrar acá. I'm going to share my screen.
Stat- ya.
Statistically. Statis. Sí, el acento
Statistically.
empieza acá. Empieza en el tis. Cuando tiene esta apóstrofe ahí, empieza el acento. Statistically.
Statistically. Ya.
Statistically,
Statistically.
Statistically.
Ya.
Yes. So be careful with that. Statistically.
Stat- Statistic.
Statistically. A ver, dale tú.
Ya. Stat- Statistically.
Yes, that's it.
Statistically.
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 Y no vi cómo lo escribiste, pero fíjate que
Ya.
esté bien escrito, ¿ya? Porque si me lo tienes escrito como lo pronuncias, hay un problema.
Es- no, no, tengo statistically.
Ya, perfecto.
¿Está
Porque
bien?
si tú me dices statically, y eso es estático,
Claro,
estáticamente, ¿cierto? No, es
sí.
statistically. Yes.
Statistically.
Statistically, claro, si no me vas a decir estáticamente. Lo otro me dices severe and disabled. Primero es severe, severe
Ya,
and
ya.
disabling, disabling.
Ah, ¿y cómo se pronuncia bien? Como que me quedo pegada. Leyéndola lo leo siempre, pero no lo
Disabling,
supe decir bien.
disabling. Severe primero.
Disabling.
Sí, severe
Severe.
primero. Severe, sí, severe,
Sí,
severe.
ya.
Y otro es
Severe.
disabling. Mira, acá está. Disabling.
Severe.
Sí. Severe and disabling. Disabling.
Disabling. Disabling.
Disabling.
Disabling.
Disabling.
Ya. Severe and disabling.
Disabling. Dystonia. Yes. Por ahí me
Ujú.
dices
Ya.
dyskinesia. Es sutil, es dyskinesia. Pero por lo menos ya está
Dyskinesia.
mejorada la última parte. Sí, me decías dyskinesia al
Ya.
principio, no es dyskinesia.
Sí.
Ahora algo mejoraste.
Dyskinesia.
Claro, dyskinesia. Ojo, la palabra kids es extremadamente informal,
Ya.
¿ya? Cámbiala
Ya.
por underage patients o algo por ahí.
Ya.
Si quieres ser
Ya.
más accurate, underage, no sé si aplica, porque underage es de 17 para
Ujú,
abajo. Quizás tu rango es menor, es,
ujú.
no sé, de 11 a 15, entonces
Ya.
deberías buscar ahí una palabra
Ujú.
que suene formal, pero underage patients, por ahí va la cosa. ¿De qué edades más o menos estás
Ya.
hablando?
No, como 12. Es underage.
Sí, pero es que underage también es misleading, porque uno puede pensar de 13 a 17, ¿cierto? Give
Ya.
me a synonym for patients from, ¿cuánto? ¿De 11 a 13, una vez así?
Ujú.
Early adolescent, pre-adolescent, young adolescent, children, children,
Ujú.
youth también puede ser, ¿ya? Puede ser
Ujú.
children age, no, pero es que ahí tendría que ser 11 to 13, to 13. Pre-adolescent, yo ocuparía. Pre-adolescent patients.
Ujú. Ya.
Eso me gusta.
Ya.
Pre-adolescent patient.
Ujú.
Patients tendría que ser con la S, ¿ya? En vez de kids.
Sí.
So be careful. Kids es
Sí.
muy formal, ¿ya? Es muy informal, perdón.
Ujú.
DBS. Esto te lo había recomendado una vez. Ahora, esto le repites tanto que yo entiendo que de repente, sí, está bien que
Ujú.
lo digas así sin nada,
Sí.
pero dentro de lo posible
Sí.
trata de ocupar un descriptive noun que le siga.
Sí.
DBS procedure, por lo menos algunas veces, no todas, porque se
Ujú.
repite tanto
Sí.
que sería como tiresome,
Sí.
¿ya? Pero
Sí.
por lo menos agrégale algunas veces DBS procedure,
Ujú.
DBS intervention,
Ujú.
DBS
Ya.
operation, ¿ya? Por lo menos algunas
Ujú.
veces para variar un poco. Después esto, literature, no, literature. Me busquemos acá la pronunciation.
Literature. Ajá. Sí.
Mira, es literature, literature.
Ay, qué
Literature.
difícil.
Ya, literature.
Literature.
Ya, liter, como de litro.
Li- ya.
Literature.
Liter a
Sure.
chur.
Sí, tres sílabas.
Ya.
Sure. O sea, o sepáralo en tres sílabas para entenderte.
Sí, po.
Liter, como de litro.
Literature.
Ya, literature.
Ujú,
O
ujú.
literature. Sí, va.
Literature.
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 Eso, tienes que marcar el ch.
Chur.
Literature. Claro.
Chur.
A ver, dale.
Literature.
Yeah, that's it. Perfect.
Literature.
Literature. That sounds very
Ujú.
good. Perfect. Literature. We still having a lot of medication. Yeah, be careful there. We are still
Ya sé. Using, no sé.
using a lot of
¿No? Sí.
medication, right? Or they are still under
Ujú.
heavy
Sí.
medication dosage, podría decir.
Ujú.
They are still
Sí.
undergoing or they're still under heavy
Ujú.
medication dosage, podría decir. They are still under
Ujú.
heavy medication dosage. O alguna alternativa, ¿ya? AMS
Ujú.
scale, cuidado. AIMS scale. Me diste una I por ahí.
Sí.
AIMS scale.
A-I-M-S-K.
MS scale. Lo otro, esto es más técnico que otra cosa. por ahí agregas additional observations that are not measured. Why weren't they measured?
Ujú.
Maybe it's worth
Ya.
explaining why
Ujú.
they weren't measured, right? No sé, una cuestión
Ujú.
más de metodología.
Ya.
Lo otro,
Ujú.
registries me dices. Registries.
Ya.
Registries.
Registry. Ya.
Registries se pronuncia. Lo otro me dice
Ujú.
strength. Strength.
Esa
Eso
no
es.
la sé decir. Cuando
Ya.
la veo digo voy a cambiar esa palabra de ahí.
Strength, así solo, es el sustantivo, fortaleza.
Ya.
Strengthen es el verbo, fortalecer. ¿Ya?
Ya.
Strengthen, eso es el verbo, fortalecer, porque el otro es el sustantivo, fortaleza.
Strengthen. ¿Y hay
Strengthen.
algún sinónimo como para decirlo con
Así
otras
creo.
palabras? Como que siento que
Strengthen.
quizá debería ocupar otra palabra.
Synonyms. Veamos. Strengthen. What synonyms could we find here?
Que lo
Bueno,
que
el
pasa cuando hay
problema de la
palabras que me cuesta mucho decir, como que me trago,
Ay,
no
que me
avanzo
gusta.
rápido.
Mira que me se quedó pegado con el anterior. Give me
Sí.
synonyms for the word strengthen. Se quedó pegado con el.
Ujú.
Ya, reinforce, boost, improve, enhance,
Improve.
increase, improve, podría ser fortify.
Improve, yo creo, ¿no? Improve Rehabilitation
Sí,
Programs, ¿puede
improve,
ser?
sí,
O
improve,
muy pobre.
es que lo ocupas harto, creo, el improve, en otra forma, en otra,
Sí, sí, es verdad.
podría ser fortify,
Sí, puede ser. Es que, sí.
support, podría ser,
Support.
support.
Sí, support. Ya. ¿Y se entiende Support Rehabilitation Programs?
Sí, claro. Sí,
Ya.
está como la idea de strengthen. If you support something, you strengthen it,
Eh,
right? Por ahí me
ujú.
dijiste, I'd like to think, that's good, pero después me dijiste, I'd like to
Ajá,
thanks. That's wrong. Ya, cuidado.
ajá,
I'd like, y
ya,
márcame un
sí,
poquito más la D. I'd like to thanks.
ya,
To think, sin ese.
ya,
I'd like to think. Yeah.
ujú,
Good. So I would
ya,
go start again to see if you do if you improved on these
ujú,
corrections a little bit, okay?
ujú, ya,
So I'm going to stop sharing.
ujú. A las 7 tengo que parar un segundito. Tengo que,
Sí, no worries.
tengo que salirme y entrar un poquito, que tengo que partir una reunión,
Okay,
porque después me voy a salir, pero tengo que dejarla abierta.
okay.
Ujú.
Y
Que,
vuelve como en 5 minutos, una cosa así.
sí, vuelvo así en 5 minutos.
Dale.
¿Puede ser?
Sí, por supuesto, ese es tu tiempo. No worries.
Ya. Ujú. Ya, parto nomás de nuevo.
Yes, go ahead.
Ya. Eh, ¿Me puedes avisar tú cuando sea las 7?
Sí, sí, sí.
Perdón.
Te aviso 2 para 7,
Ya.
una cosa así, para que tengas tiempo.
Eso, ya.
Ya, dale.
Ya, gracias. Ya,
Go ahead.
ya. First of all, I'd
Could you share,
like
please?
to... Ah, perdón. Perdón, perdón,
No
perdón.
worries.
Ya,
Go ahead.
ya. First of all, I'd like to thank the course director for the kind invitation and the opportunity to share about our experience with DBS in cerebral palsy in Latin America. It is a privilege to contribute to this important discussion and to highlight the challenges and progress that we're facing in our region. As a way to introduce the topic, I'd like to talk about the prevalence of CP in Latin America. The prevalence of cerebral palsy in Latin America is not well estimated, and it is due the lack of epidemiological studies. As you can see the map on your right, countries shown in dark blue are those who have 20 or more population-based reports, and in white are countries who have no uh, reported epidemiological information. And as you can see, Latin America is almost all in white. Based in some report from some countries in Latin America, it is suggested that the prevalence in a region is higher than high-income countries. For example, Mexico have reported 4.4 in 1,000 live births, and Brazil up to 7 in 1,000. And there are many factors that are contributing to this higher prevalence. Some of them are the poor prenatal care, the higher rates of prematurity, and birth asphyxia. Currently, a Latin American cerebral palsy registry is being developed. The final data is not yet available, but the goal of this project is to have the formal data of the CP in our regions and to promote earlier interventions. There are some interesting findings that are already mentioned, and some of them are that we have a higher prevalence of children with severe motor impairment compared to high-income countries, that in Latin America malnutrition is more frequent among children with CP compared to other countries, and we have limited access to rehabilitation services, assistive devices, and education. Moving to the topic of DBS in Latin America, I'd like to show you this very interesting article published last year, which shows some differences between Latin America and the US and Europe. One of the interesting findings that are mentioned in this paper is that dystonia is the second most common indication for DBS, of course, after Parkinson's disease. And it is different when we compare it to the US and Europe, in which tremor is typically the second most common indication and dystonia ranks third. Another findings that are mentioned are that in Latin America we use more often rechargeable devices, and in our region we perform the procedure in fewer stages, usually in only one stage compared to the US and Europe. And one possible explanation of that is that in Latin America it is difficult to have access to operating room, so it's not easy to schedule a procedure in 2 different days. When I got the invitation to this course, I was very excited about developing a Latin American database in DBS and CP with my colleague Dr. Marcela Montiel from Argentina. We designed a REDCap database and we share it with all the neurologists and neurosurgeries from who could get their emails, but sadly we only received one data entry. So we realized that there are not too many cases with reliable information in Latin America. So we decided to contact our colleagues through other informal networks. We contact them through Facebook, LinkedIn, WhatsApp, and we ask them about their experience with DBS and CP in Latin America. And now I'm going to show you some of our findings. Countries such as Uruguay, Costa Rica, Paraguay, Bolivia, and Peru confirm that they have no cases of DBS in cerebral palsy patients. On the other hand, Brazil, Mexico, Argentina, Colombia, and Chile confirmed that they have cases. We couldn't get the final information of the number of cases from Brazil or Mexico, but we could get some information about Argentina, Colombia, and Chile. Argentina have around 13 patients with DBS and CP, Chile about 12, and Colombia about 6 cases. This is the experience from Argentina. They have around 13 patients, age ranged from 6 to 24 years old, and the outcomes has been variables. This is one example of their patient. This is an 8-year-old boy who suffered an hypoxic encephalopathy secondary to an upper way obstruction at the age of 18 months. So he got a severe asphyxia, and then he developed this generalized dystonia. And after GPI DBS, you can see that dystonia improved, especially in the trunk and the upper limbs. In Colombia, they have around 6 patients. All of them have been targeted at the GPI, and the outcomes has been less successful than they expected. And in Colombia, it is a very expensive procedure. So mainly by the cost limitations and because of the outcomes that they have seen, palidotomies are now being favored in these cases with cerebral palsy. This is one of the Colombian patients. This is an 18-year-old woman who suffered a neonatal hypoxia and developed this generalized dystonia. In the first video, the DBS is off, and in the second video, the DBS is on. And you can see that dystonia have improved, especially in the upper limbs also. After reaching out our colleagues, there are some main challenges that were mentioned in the group. The first of them is the genetic testing gap. In Latin America, genetic testing is very expensive and it is usually not covered by the health systems, so patient has to afford it. So we cannot study all our patients. So we are misdiagnosing some CP patient and instead of diagnosis some patient with genetic dystonias. Another difficulty that we faced in Latin America is the limited specialized center for DBS. Each country or some countries have no centers equipped for DBS, so the access for get the surgery it's not easy. Another difficulty is the funding and coverage. The cost of the devices are not covered by the health system, and it is a very expensive surgery, and of course the device is also very expensive, so it is a procedure that it's not easy to afford by the families and the patients. And another challenge that was mentioned by the group of neurologists and neurosurgeons that we reached out was the lack access to rehabilitation. We have limited access to rehabilitation centers, and we have no enough trained professionals to follow our patient after DBS. Regarding the misdiagnosis of CP, I'd like to show you this article published last year in which patients with the diagnosis of cerebral palsy were studied with whole exome sequencing or genome sequencing. They included 13 studies with over than 2,000 patients, and they reported a diagnostic yield of 31.1% of the patient. So 1/3 of the patient was misdiagnosed with CP. And this is a situation that is not uncommon in Latin America. And this is an example of the latter. This is a 9-year-old girl who was referred to our center for evaluation, and because of her difficult to manage dystonia, he was diagnosed as CP for several years. And as you can see here in the video, the nutritional condition, her nutritional condition is very severe, and she had this movement disorder and generalized dystonia. For improve her nutritional state, we placed a gastrostomy too. She continued with the dystonia, so in the meantime, no, so after reviewing her clinical records, we realized that there was no data of any brain injury on her earliest years, so some doubts about the CP diagnosis were raised in her history. So in the meantime, we performed a whole exome sequencing and we found pathogenic variants in the KMT2B gene, which explain the whole phenotype. We all know that patients with KMT2B variants respond very well to GPI-DBS, so we promptly underwent the procedures. And here in the video, you can see that the day after the intervention, dystonia has almost disappeared. And this is in the second video, her last follow-up visit in our clinic. And you can see that he has a better use of her hands. And of course, her quality of life has improved a lot. Now, talking about our experience with DBS in Chile, it is important to mention that in Chile we have that our healthcare system is divided in two systems. 20% of the population is covered by the private system, and the remaining 80% is covered by a public system. Pediatric DBS is only performed in Santiago, which is the capital, and San Borja Argerán Hospital, which is located in Santiago, it is a referral center for complex pediatric neurology conditions. And in this center, more than 90% of the pediatric case of DBS has been performed. And in the map on your right, you can see the shape of our country. Chile is a thin and long country, and Santiago is just in the middle. So patients have to travel long distances for get to the evaluation and programming sessions. I'd like to show you some of our history. In 2014, the first DBS in a public institution was performed. It was in our hospital, in San Borja Argerán Hospital, and our first patient was a girl with dystonia. For the surgery, we contact Dr. Ron Alterman from Beth Israel, the Connect Medical Center, who traveled to Chile to collaborate with our neurosurgical team. And she's our first patient with DBS in San Borja Argerán Hospital, a girl with TOR1A variants and this severe dystonia. And after the DBS, you can see here in the videos that movement disorders almost disappear and she recovered her normal life. And here in the last picture, this is a picture that we received from her mother 3 weeks ago. And it is the graduation of Fernanda, our patient, as occupational therapist. And now she wants to work with patients with movement disorders.
Dejemos hasta acá, te hago la correction para que pases después a tu
Ya,
meeting. Son las
ya.
18:53. Mira, algunas
Hoy se
corrections.
me pasa volando.
Sí.
Ya,
Mira, y esto lo cometes. Ah, no, este todavía no. It is due the lack of. No, it is due to the
ya,
lack of. ¿Ya? It's due
ya,
to. It is due to and something. ¿Ok?
ya,
Después, de nuevo acá,
ya,
poor. Cuidado, es poor. Poor.
ya.
No es poor, es poor. Ya las dos O son engañosas ahí.
Sí,
Después, to have the formal data. No, to gather the formal data, to systematize the formal data. ¿Ya?
¿cómo lo dije? Perdón.
You dices to have the formal data, me dices. No, el
Ya,
have, cámbialo. You don't have the data. You
sí,
gather to gather the formal data,
ya,
o mucho mejor aún, to systematize the formal data. Algo así como me dice, como to
ya,
have the opportunity to have the formal data, no, to gather the formal data.
ya,
Yeah.
ya,
All the neurologists and neurosurgeries, me dices, neurosurgeons.
ya,
¿Sí?
sí, ya.
Neurologists and neurosurgeons. Después, Argentina
Ujú,
have around, no, Argentina has around, or Argentina has confirmed
ya,
around many cases. Yes.
ya,
O sea, está bien el has around, suena mejor si dices has confirmed, ¿ya? Pero lo que no me puedes decir es
sí,
Argentina have, es Argentina has,
sí,
es singular.
sí,
Lo otro, have
Ujú.
been target at the GPI, no, has, perdón,
Ya,
have been targeted at the GPI, targeted,
ya,
¿ya?
ya.
Todo lo que es have been o have más un verbo, ese verbo secundario
Ujú,
va en participio. En este caso, targeted,
ujú.
¿ya? Cuidado con los
Ya.
patient. Por ahí como tres te pillé. Patients, ¿ya?
Ya,
Patients. Lo mismo hay con center. Centers, se está hablando en plural. Cuidado con los plurales, ¿ya? O con las
ya.
S en general. Y sí, este
Ujú.
error lo cometes bastante. Me dices, por ejemplo, access for y me metes un verbo en infinitivo. Access for get.
Ya,
Access for,
ya.
no sé, study, por decirte algo. No, es
Ajá.
access to get,
Ya.
¿ya? Access to get. Y o también, alternativamente, me puedes decir que suena mucho mejor. En vez de decir access for get something, me dices access in order
Ujú.
to get something. In order to get. Suena mucho mejor. ¿Ya?
Ujú.
Por ahí me
Ya.
dices that we reach out. No sé a qué te refieres con eso. No me acuerdo en
Sí,
el slide.
sí, aquí está. Es que eso lo tengo anotado de cuando hacemos las anotaciones. After reaching out to
Ya, ahí sí.
physicians across Latin America.
Ahí sí, ahí sí.
¿Está bien? Porque
Sí,
¿cómo
sí,
podría
sí.
decir? Siempre me enredo cómo empezar esta, como después de como discutir
After
con
we,
ellos,
yeah,
como
after reaching out our colleagues in Latin America, we came to the conclusion that blah blah blah.
ya. Y
After
es
reaching,
after reaching out,
after reaching out, sí. O también puede ser alternativamente after we tried to reach out colleagues.
ya,
Yeah.
ya. Pero de ahí vienen los colleagues. After
Sí.
reaching out our colleagues,
Our
¿así?
colleagues from Latin America, claro. Porque
Ujú.
you
Ya.
successfully reached out to them, yes?
Sí.
Yeah. Entonces, after reaching out our colleagues from tanto. Yeah.
Ya,
Regard,
we can conclude
we can conclude that.
that. No, una cosa así. Ya.
Exactly. Después,
Ujú.
regarding the misdiagnosis of CP, no, regarding the misdiagnosis of CP.
Ya.
Después dice, the condition is very severe, severe means, no. The condition
Sí.
was very severe,
Ya.
¿ya? Porque el condition was, no is.
Sí.
Condition was very severe. Por ahí otro parecido al que me dices, for get, access for get, me dice por ahí, for improve. No, to
Ujú.
improve her nutritional state o in order to improve her
Ya.
nutritional state.
Ya.
¿Ya? Evita el for, normalmente va con otro verbo con ing,
Ujú.
for improving her
Sí.
nutritional state. Y se ocupa para situaciones
Sí.
más particulares. Es mejor que ocupes to
Ya.
improve o in order to improve.
O in order to improve.
Claro.
Ya.
¿Ya? Which explain the whole phenotype, which explains the whole phenotype.
Ya.
¿Ya? Variants, de nuevo, me dice variants, variants, ¿ya?
Ujú.
The day after
Ya.
the intervention, dystonia has almost disappeared. No, the day after the
Ujú.
intervention, dystonia had almost disappeared. Past. You're talking in the
Ya.
past perfect.
Ya.
¿Ya? Cuidado ahí con los
Ya.
pasados.
The day after the
Intervention,
intervention,
dystonia had
dystonia had almost
almost
disappeared.
disappeared. Disappeared. ¿Ya?
Sí.
Ve la reunión, ya de ahí seguimos con los corrections.
Ya. Vengo como en
Sí, sí, sí.
7 minutitos.
No worries, no
Ya.
worries, yo te espero.
Me voy a salir y entro al mismo link, ¿cierto?
Dale, sí, yo te espero acá.
Ya.
Perfect.
Perfecto.
Okay, so let's continue.
Ya.
Ya te
Ya.
decía, estamos con la correction. Por ahí,
Ujú.
population de nuevo, no, population,
Ya. Sí. Population.
population.
Eso
Por ahí me
lo
dices,
tengo anotado.
sí, son cositas que hay que ir ahí de poco. Otro, more than 90% of the cases has been, me dices, has been confirmed. Tiene que
Ujú.
ser have
Ya.
been confirmed. Estamos hablando de
Ya.
cases, entonces, plural.
Ujú.
More than
Ya.
90% of the cases have been
Sí.
confirmed.
Sí.
Eh, por ahí me dices de nuevo, por tercera vez este error, forget, no, to get o in order to get. ¿Ya? Tienes que tener cuidado
Ya.
con eso. Son casos muy
Sí.
particulares cuando se ocupa por forgetting. ¿Ya? Por ahí tengo
Ujú.
una clase
Ya.
al respecto después. Dice, we contacted. Cuidado con los pasados de nuevo.
Ya.
We contacted Doctor
Ujú.
something, right?
Eso, sí.
Em, igual por ahí el pasado me dice, she is our
Ujú.
first patient. She
Yeah,
was
she
our
was.
first patient. Sí, cuidado con los pasados ahí.
Ujú.
¿Ya? Ya, dale, continue. Vale, lo que
¿Te ves,
alcancemos.
cierto?
Sí, sí, sí.
Ya, sí, lo que alcancemos. For the case we just presented, and for all of the cases between 2014 and 2018, the financial barrier was our main challenge, with a cost of almost $25,000. It was almost impossible for a regular Chilean family to afford the cost of the device. So we had to organize fundraising campaigns. We had to go to TV programs and news programs to raise the necessary funds to cover the cost of the surgery. So with this um, financial difficulty, we tried to contact the government of Chile to have some conversation about the possibility to have a governmental policy about the to get the coverage of the intervention by the government. So we worked for months in a technical report for the development of a public policy on deep brain stimulation coverage for generalized dystonia, and we developed this clinical evidence and cost-effect analysis. And finally, on 2018, the government of Chile decided to include the deep brain stimulation in the coverage for patients with generalized dystonia. And this is the formal publication of the law date on March 6, 2018. And this is the group of people that worked in this project. In our center, San Borja Hospital, we have 104 cases. 59 of them are dystonia cases, 39 are Parkinson disease, and we have two patients with self-injuries behavior. It is interesting that dystonia is most common than Parkinson disease, and this is because dystonia is covered by the national health system and Parkinson is not covered yet. You can see here that our surgical times have improved from 12 to 18 hours in our first cases. Our mean time of operating room is now 4 and 38 minutes, and more than 70% of the cases are performed in only one stage. And on the right of the screen are the devices that we have available in Chile. We have Boston Scientific, Medtronic, Abbott, and Singrai. This is our series of pediatric and juvenile onset dystonia, which includes 44 cases. The median age at the surgery is 16.5 years, and the median age of dystonia onset is 4 years old. Among the causes, 18% of our patients have idiopathic dystonia, 32 of them present uh, in, no me acuerdo,
Inherited.
inherited,
Sí.
isolated dystonia. 18 had inherited heredodegenerative dystonia, and 32 of them acquired dystonia. And in the table of your right are the genetic variants that we had found in our patients. We have C patient with KMT2B, one with TAP1, one with TOR1A, GNA1, ADCY5. We have five patients with PANC2. And in the acquired group, we follow 14 patients, 12 of them with cerebral palsy, and two of them with tardive dystonia. And you already saw the map of Chile, but here are the regions from our patients come from. In our group of patients with cerebral palsy and DBS, we follow 12 patients. The median age at the DBS, it is 15 years old, and 11 out of 12, ¿cómo era?
Sí, 11 out of 12.
Así, yeah. 11 out of 12 had a GPI DBS, and one patient that I'm going to show you later in this presentation have an alternative target, and then we're going to discuss about it. All our patients have an abnormal MRI. These are the etiologies of the CP in our patients. 67% of them, the dystonia is secondary to neonatal hypoxic asphyxia. 67% the dystonia is secondary to hyperbilirubinemia, and 8% dystonia is secondary to premature birth and other hypoxic asphyxia. Among the GMFCS scale, 4 patients have a level 2 and 8 patients have level 5. And regarding the clinical manifestation in this group of patients, 5 of them have presented dyskinesias, and 4 of them have presented status dystonicus, and the intervention was performed during a status dystonicus. After 12 months of follow-up, the dystonia severity was measured by the BFM-DRS scale, which has 2 subscales, a motor and a disability subscale. In the motor scale, dystonia improved in 15%, and these results were statistically significant.
Statistically.
Was significant.
Statistically significant.
Statistically significant.
Yes.
Statistically significant. And in the disability subscale, the percentage of change was 0, and of course, it was not significant. We also measured quality of life. We used the CP child scale, and after a year of follow-up, the change on the quality of life in the whole group was 20%, and these results are statistically.
Statistics. Mira, viene de la palabra statistics. ¿Ya? Y de ahí viene, ¿cierto? Se deriva statistically, claro. La palabra base origen es statistics, ¿cierto? Statistically.
Yeah, statistics. Yeah, statistically significant. And this is one example of lateral. This is a 9-year-old boy who suffered a neonatal hypoxic asphyxia, and he developed a generalized dystonia. And in the first video, you can see that here is on a status dystonicus. And after DBS, dystonia has improved. We could stop some rescue medications. We could also decrease some other medications, and his quality of life improved. 5 of our patients presented dyskinesias. We followed them through the abnormal involuntary movement scale, the IIMS, and we could see that after a year of follow-up, the dyskinesias improved in 36%, and these results were statistically significant. And this is one patient with dyskinesia, a patient with neonatal hypoxic asphyxia. And after the DBS, um, you can see that these kinesias almost disappear, and also dystonia improved. In our series, 4 patients was operated during a status dystonicus, following this very nice no sé, guideline puede ser, guide,
Guideline o
como
article.
guía,
Guideline, sí, guideline.
article, yeah, from the teams from Boston Children's Hospital and Sick Kids from Toronto. We suggested a DBS after a complete medical treatment that failed, and in our patient, all of them had good results. And this is one example. This is an 11-year-old with kernicterus, secondary to a neonatal hyperbilirubinemia, who developed this status dystonicus after a lung infection, and he was referred to our center from the north of Chile to a DBS evaluation. And after the intervention, dystonia improved. Se puede decir in a significant manner.
Yeah,
Está
yeah,
bien, dice eso.
definitely.
Yeah, in a significant manner.
Good. Ya, dejemos hasta acá, te
And now
corrijo.
he,
Oh, termina,
yeah,
termina
yeah,
esta idea.
yeah. He is rehabilitating in his hometown.
Good. Ok,
Yeah,
vamos a algunas corrections. Financial. Se pronuncia
mhm.
financial. Financial.
Financial.
Claro.
Yeah.
Ahí te pillé por lo menos dos de esos errores. No es financial, es financial. Ya.
Sí, yeah.
Government. No, es government. Acento en la primera sílaba. Government.
Finance, yeah. Government.
Government. ¿Ya? Después,
Yeah,
cost effect. Lo tienes escrito ahí como cost effectiveness. Cuidado ahí. ¿Ya? Déjalo como
yeah.
cost
Y yo te lo,
effective. No, está bien cost
ya.
effectiveness.
Ah, ya. Ya, perfecto.
¿Ya? Pero pronúncialo así, cost effectiveness. Si lo tienes escrito de esa manera, pronúncialo
Ujú,
así. Porque también existe el cost
ya.
effect, que ahí es como la misma idea. Cost effectiveness, si lo tienes así,
Ujú,
déjalo así. Después
ujú,
dices date on y me das la fecha. No, dated. Dated y la fecha. Por ejemplo, dated
ya,
April the 12th.
ya,
¿Ya?
ya,
The article is dated April the 12th, por decirte algo. ¿Ya?
ya. Y es
Behavior. Claro,
dated March the 6th.
claro.
Ya,
Dated March the 6th.
ya,
Después, behavior, me dices. Behavior, no, es behavior. Behavior. Viewer.
ya. Behavior.
Behavior. El
Ujú,
nombre de una de los proveedores, me dices Sin Ray, no, Sin
ujú.
Ray.
Ah, sin rey. Ya.
Sin, con una I larga también. Sin Ray. Sin Ray.
Ujú, ujú.
De ahí me dices, the regions where our patients come from. Debería ser the
Ujú.
regions from which our patients come.
Ah, ya. The regions,
From which our patients come.
¿cómo?
The regions from
From,
which our patients come.
from which our
Patients come.
patients come. Yeah. The regions from which our patients come.
Claro. En la estructura come from generalmente va en la pregunta, no en las afirmaciones.
Ujú,
¿Ya?
ya.
Ya, los have, cuidado, tiendes a
Ujú,
sobreutilizar el have, busca sinónimos, ¿ya?
mm,
Trata
ya.
de grabar o de escribir, ¿cierto? Una de tus presentaciones,
Ujú,
ubica todos los have que dices por ahí si las transcribes, ¿cierto? Y trata de buscar sinónimos
ujú,
que hagan sentido, ¿ya? Porque lo
ujú,
utilizas demasiado, ¿ya?
ya.
Premature birth, me dice. No, me lo dices
¿Cómo?
bien, premature, pero después me dices birth. El problema está en birth. Es ahí, birth,
Ya.
con la Z.
Ujú,
Cuidado con el, y esto en la presentación anterior también, no te lo corregí. Status dystonia. Es status.
ujú,
Status.
ya.
Status. Status. A ver.
Ya.
Ah, mira. Me la pronuncia como status, pero está escrito como status. Parece que también es aceptable status. Bueno,
Ya.
si lo dice Cambridge, entonces no lo corrija. Ya, pero está escrito acá como status en ambos casos la transcripción. ¿Ya?
Ya.
Measured. Se pronuncia measured.
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 Eso.
Measured.
Ya.
This is an example of ladder. Of the ladder. Suena raro si lo dice sin el de.
Of the latter, sí.
Of the ladder. ¿Ya?
¿Cómo es measured?
Measured. Me. No me.
Sí.
Measured.
Sí. Measured. Ya. Y es an example of the latter.
Of the ladder. O the latter. Depende cómo lo pronuncie. Después.
Ya.
Quality of life. No, es life con F.
Ya.
Life. El otro es en vivo y en directo. Live. ¿Ya?
Ujú,
Después, dyskinesis, me dices. ¿Es
ujú,
dyskinesis
ujú.
o dyskinesis si lo vas a hacer en
Ya.
singular?
Disquinillas. Sí.
Dyskinesis o dyskinesia. ¿Se puede pluralizar dyskinesis?
Sí.
Sí, ya. Y lo otro,
Sí.
el otro detalle, distonia, me dices. Dystonia. Dystonia.
Ya.
Dyskinesia o dyskinesias y dystonia.
Ya.
Y lo último, me dijo, algo bilirubinemia, me dice. ¿Ya? Es
Ya, sí.
bilirubinemia. Nimia.
Sí. Ya.
Bilirubinemia. ¿Ya?
Sí.
Eso sería, Dani. ¿Ya?
Ya. Súper.
Cuéntame cómo te va en tu presentation una vez
Sí,
que la
de todas
termines, ¿ya?
maneras. Ujú.
Y bueno,
Ya.
ahí me avisas si necesitas
Súper.
también mantener contacto y para algún set de
Sí.
clases, si quieres
Sí.
seguir ahí en práctica, ¿ya?
Eso. Sí, me gustaría.
Ya, pues Dani, dale,
Ya te
estamos al
pasaste
habla
por
entonces.
todo. Muchas
Bye
gracias.
bye, take
Chao, que estés
care.
bien.